Personal or mental problems can manifest as a person's mood swings or feelings of sadness or anger. Sometimes he or she may have difficulty recognizing loved ones, causing confusion, sadness, or anger. People who are depressed may experience this mood swing. For example, people who are confused if they are unable to follow a conversation, or they may worry about losing their mind and become irritable or defensive. The relationship between cognitive changes and physical health. Remember that the brain is also an organ that requires good circulation and oxygen. When the body's systems are working, the brain can have a positive effect on the condition. If these symptoms are accompanied by unintentional weight loss or extreme fatigue, these overlapping patterns may indicate a deeper, more systemic decline. Whether a condition is treatable, such as a vitamin deficiency, or if it is part of a natural slowing process, it is important to ensure that patience, understanding, and gentle communication are essential to managing change. This cognitive reminds your loved one that you are there for them. Give them an explanation of the situation. Help them remember every detail. If they seem scared or confused, try talking to them in a calm, reassuring tone. Remove potential safety hazards, such as sharp objects or complicated devices, and keep daily routines predictable and simple. The next sign is another that may go unnoticed, but often becomes more frequent. Recurrent or frequent colds. You may think that your loved one is prone to colds. What may seem like a minor health issue, such as a urinary tract infection, or a mild cough, can turn into an ongoing problem that affects the body. This can be confusing. You may worry that your loved one always feeling cold or feeling like they need an extra blanket. Even though heat can certainly help them feel more comfortable, these outward signs have less to do with the temperature of the room, but rather with how the body changes its priorities, labored or irregular. Breathing changes in breathing may be obvious. You're loved. One may feel short of breath after talking for a while, or you may notice them pausing more often in conversation, just to catch their breath. Some people may switch to mouth breathing more often or complain that it is harder to take deep breaths. In some cases, fluid may build up in the lungs as the body weakens. This can lead to a persistent cough, a soft gurgling sound, or tightness in the chest that does not go away with common cold medications. People with these symptoms may prefer to sleep in a recliner or propped up on pillows to breathe more. Comfortably promotes comfort rather than improvement. When changes in circulation and breathing occur, it is natural to feel anxious or sleepy. These frequent wheezing and menkerm the body's constant movement towards death. Even though oxygen therapy or other medications are the primary goal, is to reduce discomfort. Blood mencure. The underlying cause is cool, or at a comfortable temperature. Use a humidifier. If the air is dry, and encourage short, soft breaths rather than deep breaths. Offer a drink of water if the dryness causes a cough or irritation of the airways. It may be difficult to realize that these changes may be irreversible, but your presence sitting with them, talking to them in a calming manner, alleviating any fears they may be feeling, can be a source of great comfort. We turn to topics that are often overlooked but can have a profound impact on our well-being and well-being. They often focus on physical health, mobility, appetite, breathing, and so on. But cognitive and mental changes can also provide early clues that a loved one may be approaching the end of their life. These changes may be subtle at first, but can worsen in the months leading up to their death. Confusion and forgetfulness. We all forget things sometimes, but in the years or months before their death, some older people experience increasing confusion. They may have difficulty remembering the names of people they have known for years, getting lost in familiar surroundings, or forgetting daily routines. This reflects that the brain is no longer working as well or as consistently as it used to. You may notice that your loved one starts a conversation only to lose track of what they are saying halfway through, or that they repeat the same story several times over in a short period of time. It is also possible to forget to turn off the stove or lock the door. This reflects on the question of whether or not the person is confused or has difficulty remembering things. Have you ever noticed small changes in a loved one, perhaps a grandparent, parent, or elderly relative, that started out harmless, but as time went on, you began to worry? It is a misconception that aging and death often send subtle signals up to a year before the end of life. But these signals are so easily overlooked that families often fail to notice them until it is too late to fully prepare or make the most of the final months. In this video, we will discuss 5 key indicators that often appear in the year before the end. These signs do not come with a sense of clarity and compassion. Fear and sleep with clarity and compassion and perhaps create precious memories. The remaining 10 kilo we began to lose weight. Maybe the first sign of significant and unintentional weight loss. Maybe the end of the year. Weight loss that is not part of the GA-HID milking process. You may have loose clothing, a loose belt, a tight waistband, a tight meal. They are immune and appetite also increases as we age, but sudden or significant. Weight loss without a clear explanation is almost never a common occurrence. This may indicate a vital issue and muscle tone and nutrient absorption. Aging naturally involves some muscle loss, but if it seems to happen rapidly, it may indicate that the body is no longer functioning at its usual capacity. Perhaps the digestive system is not breaking down food as efficiently, or perhaps the person is producing fewer enzymes needed for proper nutrient absorption. As muscle mass decreases, a person's overall strength decreases, leading to greater susceptibility to infection increased. Risk of falls and general decline in endurance. Imagine a loved one who used to do everyday tasks like carrying groceries or just moving around the house. He or she may be losing weight slowly from minor illnesses or frequent colds. This is a sign that the body's energy and defenses are no longer what they used to be. Unintentional. Weight loss is a change in appetite. Many older people no longer feel as hungry as they used to. Their sense of taste may become dulled, making food less appealing foods. They previously enjoyed may lose their taste. There is also a physiological component. As the body begins to slow down, stops, sending strong signals to the brain that say, "I need food." This results in smaller portions, missed meals, and subtle weight loss, but consistent energy levels and overall health in some families. The first reaction is to encourage their loved one to eat more, offer them their favorite foods or snacks, or bring them nutrient-rich foods such as protein shakes. Although these efforts may help in the short term, especially if the loss of appetite is mild, they often fail to address the root, because if the body is actually preparing for the final stages, you may notice that the person is becoming overwhelmed with eating. Forcing them to eat can be frustrating and even uncomfortable. Underlying medical problems. Weight loss in older people is sometimes associated with underlying medical problems, such as certain cancers, heart failure, or kidney disease, chronic diseases that can progress unnoticed before the onset of dramatic symptoms. Depression, dementia, or other cognitive impairments can also play a role in appetite suppression. If you suspect these conditions, it is important to consult a healthcare professional. However, if repeated medical interventions fail to reverse the weight loss, this may be a strong indication of a deeper decline in the organism. Provide comfort and support. If you notice weight loss, consistent body, think of it as a wake-up call rather than an alarm bell that you should turn off. Offer them easy-to-eat, nutrient-dense foods in small portions and help them stay hydrated. Watch for signs of discomfort. While eating, they may be tired of chewing or swallowing. As Mesha says, it's important to realize that as difficult as it may be, your body is preparing for the final transition. These are the times when comfort is a priority. Trying to fix something that may not be fixable, loving support can make all the difference between us. Feeling tired and exhausted. Feeling tired is normal, especially as we age. But the kind of fatigue we're talking about here goes far beyond the occasional need for a nap. It's a deep, persistent fatigue that doesn't go away with rest. The kind of fatigue that makes even the simplest of tasks a chore. The elderly who love to eat and talk can become painful with naps. NAT manages or accompanies this type of fatigue to end the hinyayu sinendi jomless, and instead uses their energy for the task at hand. Every day the body stores its energy for essential functions. Metabolism slows down and activity decreases in addition to weakening organs. The metabolic process also begins to slow down. Imagine our body as a machine that must decide where to allocate a limited amount of energy blood, dedicate to activities that are ambitious, things like standing up regularly and vitalin. This and raise the time that is all and senunaner are. With you able to be alert the next time. They are awake or want to lie down. They are not or are not interested. They just can't maintain their usual energy levels. Emotional kikwi. One aspect that comes to face fatigue continues to menor. Many elderly people who have always been independent may feel embarrassed or discouraged because it is easy for them to get dressed or buy food. They may enjoy going out or hobbies, not being able to follow this withdrawal. That creates isnya and caregivers or anga out. It is natural for you to worry or frustrated. You may encourage them to move a little more, or men will just say if he or she wants or suggest light activities that he or she appreciates to make his or her final months more peaceful. It is about finding a delicate balance between support and respecting the signals that the body is sending. Now let us move on to the third sign of changes in circulation and breathing, indicators that often go hand in hand with the fatigue and weakness that we just discussed. And there are obvious changes in breathing and circulation. Sometimes the little things that we can actually see or feel can reveal profound changes in the body. You may touch your loved one's hand and notice that it is colder than usual, or you may notice a bluish or pale color around the fingers, toes, or lips. This often means that blood flow is being diverted from the extremities to the vital organs. Decreased circulation to the extremities when the heart weakens. It no longer pumps blood as efficiently as before. The body's survival instincts kick in, making sure vital organs such as the heart, lungs, and brain are deprived of blood supply. This causes reduced blood circulation to the hands, feet, ears, and nose, making them cool or even cold to the touch. You may notice subtle changes in color, bluish or mottled, especially around the fingertips or toenails for family members. Every day the body stores its energy for essential functions. Metabolism slows down and activity decreases in addition to weakening organs. The metabolic process also begins to slow down. Imagine our body as a machine that must decide where to allocate a limited amount of energy blood, dedicate to activities that are ambitious, things like standing up regularly and vitalin. This and raise the time that is all and senunaner are. With you able to be alert the next time. They are awake or want to lie down. They are not or are not interested. They just can't maintain their usual energy levels. Further, our immune system is compromised. Our immune system is a complex system of white blood cells, antibodies, and several layers of defense. As a person ages and approaches the end of life, these defenses may no longer be as strong or effective. Skin wounds may take longer to heal, and they are more susceptible to respiratory infections that can progress to pneumonia. Urinary tract infections may become recurrent, difficult to treat, and more exhausting. The vicious cycle of illness and disease continues because their body is already functioning at a reduced capacity. Infections can drain what little energy they have left. Even if the underlying problem is resolved, may never return to baseline. Over time, recurrent illness will undermine overall well-being, fatigue, weight loss, and other signs. Families often try multiple treatments, doctor visits, antibiotics, increased hygiene, etc. And although these measures may offer temporary relief or comfort, the underlying frailty remains. In some cases, recurrent infections are a sign of the body's declining ability to heal, confirming that end-of-life changes are taking place. Gentle interventions. If your loved one is suffering from frequent infections, focus on their comfort. Make sure they stay hydrated, have clean bedding and clothing, and treat any pain or discomfort promptly. Monitoring medication, if prescribed, can help manage symptoms. However, it is important to be aware that long-term recurrent infections may not be possible. If the immune system is compromised, any subsequent treatments are more aimed at improving comfort. As long as your breath has not ended, then enjoy life to the fullest. Thank you for watching this video. Don't forget to like, share, and subscribe so that we are more enthusiastic about creating content for you.